Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Welcome to the presentation on emergency management of diabetes mellitus in a dental setting. You will observe some points repeated throughout this presentation, but they will be explained in different ways. By listening carefully from start to end, you will gain a strong understanding of this topic. We will discuss the importance of maintaining normal serum glucose levels for patients with diabetes. Understanding the risks of ketoacidosis in type 1 and hyperosmolar state in type 2 is crucial for appropriate management. In dental settings, the immediate concern is hypoglycemia because the most common emergency in dental settings is hypoglycemia. Proper management of diabetes in a dental setting is essential to prevent complications. Hypoglycemia often occurs due to imbalance of insulin, dietary intake, and glucose use. Key factors lowering serum glucose are increased insulin, decreased caloric intake, and increased metabolic rate, such as anxiety, can lead to hypoglycemia. Patients on oral hypoglycemics are less likely to experience severe hypoglycemia compared to those on insulin. Patients often recognize early signs of hypoglycemia include hunger, nausea, lightheadedness, and headache. As hypoglycemia progresses, the patient may become irritable, lethargic, and less able to concentrate or converse. Severe hypoglycemia can cause excessive sweating, tachycardia, piloerection, increased anxiety, unusual behavior, senselessness, and unconsciousness. Preventing hypoglycemia involves keeping serum glucose levels on the higher side of normal or even temporarily above normal. A thorough health history interview is essential for diabetic patient. During the health history interview, assess the patient's diabetic control. Ensure the patient regularly monitors their serum glucose or knows their hemoglobin A1C levels. If patients do not regularly check their glucose levels or unsure of their HbA1c level, contact their physician to determine if the routine dental care can be performed safely. Proper management of insulin and glucose intake during dental procedure is crucial for patient safety. Contact the patient physician to confirm the safety of dental procedures. If a patient shows a sign of hypoglycemia, immediately stop the dental procedure. Provide a high caloric carbohydrate source such as sugar packets, fruit juice, or glucose gel. If the patient does not improve quickly or become unconscious or cannot take glucose orally, administer 50% glucose intravenously. If venous access is not possible, give glucagon intramuscularly. As a last option, use epinephrine subcutaneously and repeat every 15 minutes if necessary. After recovering from hypoglycemic episode, the patient should be monitored for at least 1 hour in the office to ensure full recovery. Continue to monitor the patient and treat with oral glucose sources if any further symptoms arise. Make sure the patient has someone to accompany them home. Give the patient clear instructions on how to avoid hypoglycemia during future dental appointments. This box, taken from your textbook, outlines the signs and symptoms of acute hypoglycemia. Let's explain the management steps using a flow chart. We will go through each step of the flow chart in detail, ensuring a clear understanding of the entire process. Is pointed earlier that please be aware that many points we have already covered will be repeated, but it is important for the students to listen carefully. Flowchart displayed here provides a structured approach to handle the hypoglycemic episodes, crucial for ensuring patient safety during dental treatment. This flowchart explains hypoglycemia management by dividing it into 3 categories. One is mild, moderate, and severe hypoglycemia. Each category has specific steps to ensure effective and timely intervention. The first and immediate step is in any hypoglycemic episode, this is number one, is to stop all ongoing dental procedures to focus on the patient's medical need. For mild hypoglycemia, give patient a source of glucose like sugar or fruit to quickly raise blood sugar levels. It is important to monitor the patient's vital signs to ensure they are stable. If there is any uncertainty about the cause of hypoglycemia or the patient's condition, consult the patient's primary care physician before continuing with any dental treatment. For moderate hypoglycemia, this portion of the flow chart, provide the patient with glucose source orally, such as sugar or fruit juice. Continuously monitor the patient's vital signs to track their condition. If there is no rapid improvement, administer 50 ml of 50% glucose or 1 milligram of glucagon either intravenously or intramuscularly. Ensure to consult with the patient's physician before continuing with any further dental procedures to confirm the patient is stable. Severe hypoglycemia requires immediate administration of 50 ml of 50% glucose intravenously or intramuscularly, 1 milligram of glucagon. Ensure someone calls for medical assistance immediately. Continuously monitor the patient's vital signs to assess their condition. Administer oxygen to help stabilize the patient's breathing. Transport the patient to an emergency care facility for further treatment and monitoring. Let's review the key points we have covered in the presentation. Recognizing hypoglycemia early can prevent severe complications. Similarly, more severe symptoms should be identified to prevent complications. Preventing hypoglycemia involves keeping serum glucose levels slightly above normal. During the health history interview, assess the patient's diabetes control. Ensure the patient regularly monitors their serum glucose or knows their hemoglobin A1C levels. Contact the patient physician to confirm the safety of dental procedures. If a patient shows signs of hypoglycemia, immediately stop the dental procedure. Provide a high-caloric carbohydrate source such as sugar packets, fruit juice, or glucose gel. If the patient does not improve quickly, becomes unconscious, or cannot take glucose orally, administer 50% glucose intravenously. If venous access is not possible, give glucagon intramuscularly as a last option. Use the epinephrine subcutaneously and repeat every 15 minutes if necessary. After recovering from hypoglycemic episode, the patient should be monitored for at least 1 hour. Treat any further symptoms with oral glucose sources. Make sure the patient has someone to accompany them home. Give the patients instructions on how to avoid hypoglycemia during future dental appointments. To conclude, managing hypoglycemia in dental settings involve early recognition of the symptoms of hypoglycemia and take preventive measures. And immediate treatment to prevent severe complications, understanding the signs and symptoms of hypoglycemia, and knowing the appropriate steps to take can save lives. Always prioritize patient safety by closely monitoring their condition and consulting with their physician as needed. Using strategies to prevent hypoglycemia during dental care, following these guidelines helps dental professionals care for patients with diabetes safely and effectively. Thank you. Wish you best of luck.